bring in our political editor, Andrew Clennell, and Gabriella's absolutely right. There's no chance the lockdown ends then. In fact, the question is, will it be a tougher lockdown?
Yes, and we're getting signals that could occur, aren't we? So let's have a look at this curve again, because I think it's important to looking at even tougher restrictions. And don't forget that New Zealand-style lockdown we flagged includes shutting everything from butchers to hairdressers, fruit shops, etc. So have a look at that. So 2nd of July, 77 cases. They do the suburban lockdowns. And you've got sort of 18 cases a day in New South Wales now. That was 77. And then on the 4th of July, you flagged the following week they're probably going to lock down or shut down all of Melbourne. And that occurred. And the numbers are pretty steady. They go up a bit, up a bit, up a bit, and now this massive rise. And 3.5% of those tests being positive yesterday. It's really grim. So Scott Morrison before, Kieran, flagging that the AHPPC will consider tougher restrictions. Paul Kelly in the last hour, the CMO, the new Chief Medical Officer of the Commonwealth, telling us that they have prepared advice, the health officers, for National Cabinet to consider. There's no formal COVID National Cabinet for another week, but that's not to say that the Premier of Victoria couldn't be shown this advice tomorrow. Let's have a listen to the PM and then Paul Kelly.
As it has moved into other communities, that is obviously of great concern, and we can't rule out further restrictions or limitations to stem this outbreak. And we'll be sharing our views again with the Victorian Government about that, based on what the AHPPC is considering today and the advice that we're receiving directly.
So we've put that all together. We will be providing that as advice through to the Prime Minister and the National Cabinet, and that will be discussed later tonight. But I won't go into the details of what that might lead to in terms of any further measures in Victoria. That's obviously a discussion and a decision for the Victorian Government.
And we know that one of the major problems has been in aged care. 1 in 6 of these cases is in aged care. 10 of the 13 deaths yesterday were in aged care. It's been a debacle in terms of the handing over of some of the centres by Victorian Health, with a lot of the workers there infected. In St Basil's, they just came out in a hurry and the feds went in. Everyone knows what happened there was inadequate. The Prime Minister said so. The head of the Health Department, Brendan Murphy, said so yesterday. Jim Carabinas with a terrible story about the way his mother, who's now been found to have COVID-19, experienced.
Our experience has been that after describing to the doctor on site that these are the critical levels of care that are needed, the following day we received the phone call from my mother actually asking and screaming and begging for help. My mum needs 2 people to assist her to go to the toilet. She was on pressing the buzzer for approximately an hour and a half and had no response. After an hour and a half, a staff member assisted her to go to the toilet, and the discerning part and the difficult part to accept is that she was actually left on the toilet unattended for 1.5 hours.
And we've seen a litany of errors, certainly in terms of the response in Victoria, the health response to contact tracing, the inadequate delays in testing, and the latest incident we can point you to is this situation where a woman was tested on July 18, got her results back July 20, found to be positive, and then was told on July 28, you're okay, you can go out in the community, you can go to work. And that was a letter from the Deputy Chief Health Officer, and she hadn't even had a second test. And Dan Andrews has been at pains to say you have a second test at day 11. So that's very disappointing again from the Victorian Government. There just seem to be a number of incidents here where things aren't being handled in an ideal situation. Just told then, Kieran, that I believe Scott Morrison will be talking to Daniel Andrews this evening. So no doubt then he'll be in the receipt of that AHPPC advice. And let's see if we get some tighter restrictions tomorrow. You don't have to speculate that could be the case. I don't think Scott Morrison and Paul Kelly are talking about it unless that advice talks about tougher restrictions. That's right, isn't it? And now we've got Daniel Andrews telling us today, for example, the mixed messages somewhat, that in those regional Victorian areas, you're going to have pubs and restaurants still open, but you can't visit people at their homes. So I'm not sure that's the right message given how dire the crisis is, but he explains it here.
I will put in place the restrictions that are targeted to dealing with the problem. We're not going to just, so that there's a sense in the community that we're doing things, going to do things that are disconnected from where the problem is. That doesn't make any sense. That just costs jobs and I think adds to the sense of frustration and fatigue that everybody is feeling. If the data said that this was being transmitted in cafes, restaurants, pubs, then we would shut them. Don't be in any doubt about that. But that's not the position that the Chief Health Officer's detailed analysis and the Public Health Team's detailed analysis of these numbers, that's not what the data tells us.
Kieran, you almost get the impression with these numbers where they are that they've just got to give a tighter lockdown a go. It might not work, it might be too late for Victoria, but you feel that way. And I thought it was an interesting change of rhetoric from a PM who's always talked about keeping things open as long as possible, reopening before the states wanted to, actually pointing out that the right health outcome can help the economic outcome.
We have now been in this lockdown now for some weeks, and we are not getting the results we would hope for. And as a result, the further measures that are taken are certainly necessary. They will come at an impact to the economy, and we understand that. But equally, not containing these outbreaks will have that effect also. And so it's important that we continue to work together to get on top of this and to take whatever actions are necessary.
Whatever efforts they can put into contact tracing from here, apart from any shutdown, I'm told is absolutely integral to success here, Kieran. They really have to triple their efforts in relation to that. And for Richard Marles's part, he wasn't happy with the way that the last couple of days the Prime Minister was calling it the Victorian wave. Here's the Deputy Labor Leader.
I don't actually think it helps to hear the Prime Minister talk about this as the Victorian wave and seek to, in a sense, disassociate from it. This is a moment where tough things need to be done and tough players stand up and take responsibility and actually put in place some action. And we need to see that on the part of all our leaders, but we need to see it on the part of our Prime Minister as well.
Yeah, given the nature of where we are right now in this crisis in Victoria, you would think that I know there's not a formal National Cabinet scheduled according to the calendar tomorrow, but there'd have to be some pretty serious talks between the Premier, the Prime Minister, with that advice from the Chief Medical Officers. And given the language we've heard, and as you said, the Prime Minister's discussion around economy versus health and so on, I honestly can't see how there's any other option, and particularly in the context, if we look back a few months to March, when it was Premier Andrews who was driving the harsh lockdowns, and he was the toughest in terms of that. And now, in the face of these really concerning numbers, why wouldn't he be thinking this along the same lines?
You've got to give it a go because people are dying, don't you? I mean, you've got to give it a chance. I appreciate what Andrews is saying about jobs. It was different to what he was saying in March, that's for sure. But and I appreciate it's awful if further businesses are forced to shut down. But don't you have to try everything? We've got the situation. The PM's kind of indicated that it could occur. We know the AHPPC's prepared advice. We know the PM's talking to the Victorian Premier tonight. I'm sure there'll be extra discussions in the morning. I think it's likely there'll be tighter restrictions by the time we appear on Sunday morning on Sunday Agenda, Kieran.
Yeah, indeed. Andrew, hard to disagree with that. Thank you. We'll talk to you then.